Good day, everyone. I, Reine Gabrielle Bayot, together with my groupmates Miss Katherine and Calma, Miss Yvez Vyanka Castillo, Miss Maria Colleen De Leon, and Miss Karen Maxilie Pacong, will be presenting to you our problem-based learning report about dialysis. In our presentation, we will be explaining an introduction to what dialysis is, its different types and uses, and the restrictions to be followed when undergoing this treatment. Before we dive into the discussion, let us first review a few concepts to refresh our minds for the said topic. So the bodily system, which is responsible for cleansing our blood, is the urinary system. It works as a filter which separates nutrients and unwanted toxins and wastes, which the body excretes as the substance of urine. Its main organs are the kidneys that specifically do the job of purifying the blood. Hence, if complications occur in this particular organ, the whole organ system is affected, putting the individual's body into risk. With that being said, what is dialysis? What does it do? When and who needs this treatment? Dialysis, as defined by the National Health Service of the UK, is a procedure to remove waste products and excess fluid from the blood when the kidneys stop working properly. In simpler terms, it is a clinical treatment that works as a substitute for the normal function of the kidneys in filtering the blood. Specifically, it keeps the body in homeostasis by preventing the buildup of waste, salt, and excess water in the body, which is released as urine, managing chemical levels of substances such as potassium and sodium and bicarbonate in the blood, and help regulate blood temperature. Dialysis is recommended to patients who are diagnosed with chronic kidney disease or CKD, or also known as end-stage renal failure. The treatment is advised once the kidneys have lost 85% to 90% of their function and show a test result of less than 15 and the glomerular filtration rate or GFR. Since CKD is not curable, receiving treatment during the early stages of kidney disease is encouraged as it is still reversible. Symptoms of this disease do not usually show until the late stages. So knowing its risk factors and late-stage symptoms is a preventive way to stop it from worsening. Moreover, a result of less than 60 may also indicate early kidney disease in the GFR.
Thank you for sharing your insights, Ms. Reine. To proceed, let us now tackle the different types of dialysis, how each type of dialysis works, and how does one knows whether one should take this type of dialysis. First, there are actually two types of dialysis. These are hemodialysis and peritoneal dialysis. Hemodialysis is where it involves a machine that removes blood from the body, filters it through a dialyzer or artificial kidney, and returns the cleaned blood to the body. Under hemodialysis, there are two types that can also be used. These are the in-center hemodialysis and home hemodialysis. Its difference is that in-center hemodialysis is a 3 to 5 hour process that may take place in a hospital or a dialysis center 3 times a week. Whereas for home hemodialysis, from the name itself, home, therefore aside from a hospital or a dialysis center, hemodialysis can also be done at home. However, at-home treatments should take place 4 to 7 times a week for fewer hours each session. Now that I've tackled these two types of hemodialysis, let me now proceed. What are the minor surgical procedures that must be done before undergoing hemodialysis? First, a patient may have arteriovenous fistula or AV fistula. This is where a surgeon connects an artery and vein in the arm. However, if the artery and vein are too short to connect, the surgeon will use a graft or soft hollow tube to connect the artery and vein or arteriovenous graft, AV graft. Proceeding, What happens during hemodialysis is that the dialysis machine will remove blood from the arm using a needle. It will then circulate the blood through the dialyzer filter, which will move waste into a dialysis solution that contains water, salt, and other additives. Lastly, it will return the filtered blood to the body in the arm through a different needle. It also monitors the blood pressure to adjust how fast blood flows in and out of the body. Now, for the next type of dialysis, let me call Miss Colleen to discuss it. The floor is yours.
Thank you, Miss Carol. For the next type of dialysis, aside from hemodialysis, we also have peritoneal dialysis. Peritoneal dialysis is where tiny blood vessels inside the abdominal lining or the peritoneum filter blood through the aid of a dialysis solution, which is a cleansing liquid that contains water, salt, and other additives. Now, this process actually takes place at home, and there are two ways to do this treatment. First is the automated peritoneal dialysis. This procedure uses a machine called a cycler that pumps the fluid in and out of the body while the person is asleep. Whereas for the second way, it is called continuous ambulatory peritoneal dialysis or CAPD, wherein it takes place manually. Now that I've tackled these two ways for peritoneal dialysis, let me now proceed to what happens before undergoing peritoneal dialysis. First, 3 weeks before undergoing peritoneal dialysis, a minor surgical procedure must be done where an insertion of a soft, thin tube or catheter through the belly and into the peritoneum will take place. This catheter stays in place permanently. Proceeding, what happens during peritoneal dialysis is that the catheter must be connected to one branch of a Y-shaped tube. It is because this tube connects to a bag that has a dialysis solution. The solution flows through the tube and catheter into the peritoneal cavity. Thus, after about 10 minutes, when the bag is empty, the tube and catheter must be disconnected and catheter must be capped off. Following, for about 60 to 90 minutes, the dialysis solution inside the peritoneal cavity absorbs waste and extra fluids from the body. Afterwards, the cup from the catheter must be removed and used the other branch of the Y-shaped tube to drain the fluid into a clean, empty bag. These procedures must be repeated up to 4 times a day. Therefore, a patient will sleep with the solution inside its stomach all night. Finally, to know whether one should take this type of dialysis, a doctor will help determine which type of dialysis it is based on several factors, including one's overall health, kidney function, signs and symptoms, quality of life, and personal preferences. However, hemodialysis is ideal for patients with less kidney function. Meanwhile, peritoneal dialysis is not a good option for obese patients or people who have abdominal scarring.
Now that we have heard about the types of dialysis from Miss Carol and Miss Colleen, we now move on to how dialysis patients live their lives. You might be wondering if a person needs to undergo dialysis, can he still do normal activities such as working and traveling? Just because you are on dialysis does not mean you have to cut out important activities such as work and travel. As soon as you get used to dialysis, you can go back to work. However, if your work involves a lot of physical labor, you may need to switch to a different job. With proper planning, it is safe for most dialysis patients to travel. You will need to take note of the dialysis centers near the place you are going to so that you can make appointments and continue treatment while traveling. But do remember to consult your doctor regarding your activities and figure out which dialysis modality works best for you. The restrictions associated with the renal diet depend on the person and the severity of the kidney illness. Certain limits apply to a renal diet. If you have a renal disease, schedule a consultation with your doctor to discuss the best diet for you. The majority of renal diets aim to cleanse the blood of waste and poisons. As a result, while receiving dialysis, your doctor may probably urge you to minimize the following. First is sodium. Sodium is a major constituent of many food items and, of course, table salt. When you have kidney disease, your kidneys are unable to drain out the excess sodium. Therefore, doctors recommend less than 2,000 grams of sodium per day. Second one is potassium. Although potassium is crucial for your body, people with kidney disease should limit it. Doctors recommend less than 2,000 grams of potassium per day. Some low potassium foods are the green beans, corn, apples, grapes, and pineapple. Then phosphorus. When you have kidney disease, your kidneys are not able to eliminate excess phosphorus from the blood. It is not good for your health. Therefore, doctors recommend less than 800 milligrams to 100 milligrams of phosphorus per day. And also, you can eat fruits. Some low phosphorus foods are fresh fruits and vegetables, rice milk, unenriched bread, pasta, rice, and fish. And lastly, protein food and fluid. Here is an example of a dialysis diet chart. With this said, the cost of dialysis session will be shared by Ms. K.
Thank you, Ms. Yvez, for showing about the lifestyle and restrictions of dialysis patients. Adding to this, how much do dialysis sessions usually cost? The cost of dialysis sessions in the Philippines range from 2,000 to 7,000 pesos, but this also depends on the type of dialysis and the hospital you're being treated at. Public hospitals tend to charge less compared to private hospitals, but there are only limited slots in the government hospitals. Some private hospitals and dialysis centers offer sessions at lower prices. The cost of each dialysis session can still be lowered if you are covered by health insurance from agencies like PhilHealth. As dialysis sessions frequently occur 3 times a week, it is important to compare prices and find out which hospital or dialysis center is most convenient for you. So that is all for our presentation, and we hope you learned a lot about dialysis. Here are the references used in enriching our discussion. Once again, this was Group 6. Thank you for listening.